Welcome, caregivers. In this video, we will discuss how to administer inhalers to residents. Before we begin, we want to check the resident's record to see if the resident has any allergies. We will then collect the medications from the secure storage area. Only remove medications for one resident at a time. Review the medication administration record to verify the correct resident, medication, dose, time, and that the medication order is current. Next, we want to physically examine the medication and compare the information on the medication label to the documentation on the medication administration record to ensure it matches. If it matches, continue. If it doesn't match, do not administer the medication. Follow your facility's policy to seek clarification concerning the medication. We want to check the medication expiration date. After doing this, you will have performed all 6 rites. It is important to follow the medication label and administer the medication at the time prescribed or scheduled. Read the label again and compare it to the medication administration record. If it matches, you may move forward with administering the inhaler. Prepare medications for one resident at a time to avoid any mix-ups. Return the inhaler to the locked cabinet once the resident is done using it. It's almost time to administer this medication, but first we need to check the equipment and clean it if it is dirty. We'll need to wash our hands and put clean gloves on. Once you have finished washing your hands, we'll go identify our resident. Say hello and introduce yourself. Hello, Mrs. Johnson. I'm Luke. How are you? I'm going to be your caregiver today. I have some medication to administer to you. Can I verify your name and date of birth? Awesome. Thank you. One more question, Mrs. Johnson. Do you have any known allergies? No? Great. Next, assist the resident to a comfortable sitting position. Explain to the resident the medications you will be administering. This is an inhaler prescribed by your doctor to treat asthma. Before I administer your inhaler, do you have any questions or concerns about this medication? No? Great. Let's get started. Next, you should give the resident tissues. Then load the dry medicine in the inhaler chamber as directed by the manufacturer. Have the resident exhale normally, away from the inhaler chamber. Then have the resident place the mouthpiece in their mouth, with lips sealed around the mouthpiece, and then forcefully inhale through their mouth. Once this is completed, have the resident hold his/her breath for up to 10 seconds. Then remove the mouthpiece and ask the resident to exhale slowly. If more than one puff is ordered, wait 30 seconds and then repeat the steps for subsequent puffs. Be sure to wait 30 seconds between puffs. Leave the resident in a comfortable position following observation of the results. Remove and dispose of gloves properly and wash your hands. Then cleanse and replace the equipment as specified on the medication administration record. Our final steps are to document the administration of the inhaler on the resident's medication administration record. Caregivers are to include the name of the medication given, the number of inhalations given, your initials, and any refusals or unusual complaints or action taken. Remember, any resident prescription medication refusal must be reported to the prescribing physician. That concludes our video skills training on administering inhalers to residents. Thank you for learning with us today. See you soon.